third edition of Women's Health Weekly. We're absolutely fully excited to be here. We had a great crowd last time and it was a lot of fun. So we're really looking forward to doing it again. I'd like to welcome my co-host again this week, Dr. Kenneth Davison. And I'd also like to welcome longtime friend, respected professor, colleague, expert in sexual health, expert in vulvovaginal disorders, world-renowned guy, Dr. Andrew Goldstein. Thank you so much for joining us. We really appreciate it. We look forward to an exciting talk. Here's my first sort of piece on this, is that we know there's a lot of information out there, but what we want to deliver to you here is information from the experts, and that's why we asked Dr. Goldstein to join us. So let me go right to Dr. Goldstein and ask him the big question on my mind. What is a vulva?
It's pretty simple, Ken. It's basically the external genitalia, what people call the lips or the labia, the clitoris, all that is the vulva. And so what you can see, unless you're a gynecologist and look inside, which is really when when people talk about the vagina, they're really talking about the vulva.
And is there a better way to describe it for women who aren't quite, listen, we're gynecologists, so we look at vulvas and vaginas all the time. It's what we do. We very clearly understand the anatomy. Is there a different way to describe it for women who maybe aren't quite getting it? Or should I put a picture up?
Picture would be great, but also women should really get to know their own anatomy and their own vulvas. So the best way they can learn is actually take a mirror down there and or even use their cell phone and take a photo. We would encourage women to do vulvar self-exams. They should, just like they'll do breast exams. They should look at their vulva, know what's normal for them, and see the texture, see the color, and explore their own anatomy.
So that's perfect. That's great, and that seems like a really easy thing to do. Dr. Davison, is that what you're telling your patients to do on a regular basis?
I can't say that I would say that on a regular basis for every routine patient. My practice is a bit of routine as well as chronic pain, vulvar disease. Certainly, especially the patients who come with a complaint, a lesion, known vulvar disease, pelvic pain, then yes, I encourage them. I actually show them with a mirror in the office, and I know Dr. Goldstein does it as well. So that they know exactly what I'm talking about, including if it's applying medication or monitoring a lesion. So certainly in that subset of patients, maybe I should be, but not always routinely in routine patients. So it's a good PSA, Dr. Goldstein.
People, if they start having problems, they got to know what it looked like beforehand. Right. People say, well, I never noticed this, or I did, and so this way they'll know. I'm not saying that this has to be done on a daily basis, but once a month, once every 6 months, just look, know your body, and in case there's a problem, then you have a baseline.
That's a great segue into the next topic that I want to go to, is what am I looking for if I'm a woman who's doing regular vulvar exams? What am I looking for to give me an early warning or an early sign on my vulva that maybe something's not quite there, quite right, or something's just plainly abnormal?
You're looking for texture changes, color changes, anatomy changes, tears, fissures, and those are mainly the things you're looking for.
I would agree with that, and I think a lot of patients will come with a complaint about what's this, I noticed this, and I do say to them, well, have you looked before? And so that's true. Like it might come up that they have a complaint or a symptom, and then that prompts them to look, but then they never had the baseline. So that is sort of going back to the point of having a baseline. It's helpful to see if there is one of these changes that we're talking about.
One of the things I do want to point out is that, one thing that people do focus on a lot of times is how red something is or how red their vulva is. And that changes dramatically depending on how much blood flow goes to the area. So if a woman looks when she's aroused, it's going to look redder, fuller than if she's not aroused. It also changes with hormones as well. So that's a good idea to get a baseline. And again, don't focus so much on red, but you're focusing on more of texture changes and erosions or tears or fissures or or anatomy changes.